Hello, everyone, and welcome to today's webinar, HR Issues in the Time of COVID. Before we get started, I'd like to go over a few items so you know how to participate in today's event. You have joined the presentation listening using your computer's speaker system by default. If you would prefer to join over the telephone, just select Telephone in the audio pane, and the dial-in information will be displayed. All attendees are in listen-only mode. You will have the opportunity to submit text questions to today's presenters by typing your questions into the questions pane of the control panel. You may send in your questions at any time during the presentations, and we will address them at the conclusion of the presentation. Today's presentation is being recorded and will be sent out to you within 72 hours of the completion of the live presentation. The information contained in this presentation is provided for general informational purposes only and is not intended to serve as legal advice. I would now like to pass the presentation over to Jen Jackman.
Good morning and happy Wednesday. Today we're going to tackle some hefty issues involving HR in the time of COVID. So let's briefly go through our agenda. We're going to do a brief ADA review, understanding that most people on this call will already have a baseline. So just to review some important concepts for how we tackle issues with the COVID vaccine. We're going to discuss briefly some requests for accommodations, what constitutes an undue burden for the employer's perspective, discuss briefly the FMLA and FFCRA, the intersection of the ADA, the FFCRA, and FMLA in terms of leave requests, the COVID vaccine, and COVID inquiries. And really what we're going to focus mostly on is when if you're requiring the vaccine, does it become a disability-related inquiry? So just about the ADA in review, we all know that the ADA prohibits discrimination against qualified individuals who have disabilities, who have a record of a disability, or who are regarded as disabled. And there are two main ways that employers can violate the ADA. One is by a failure to accommodate, and that's really what we'll be talking about more today. But the other one is discrimination based upon a disability, and that can be a disability that is real or one of those where you're regarding someone as disabled. So with the Americans with Disabilities Act, it prohibits discrimination against qualified individuals, and that person has to be qualified to perform the essential functions of that position. It prohibits discrimination based on disabilities, the record of a disability, or regarded as disabled. But what it requires employers to do is to provide a reasonable accommodation to an otherwise qualified individual with a disability unless it imposes an undue hardship. And when you get to that point of whether it's an undue hardship or whether you need to allow the accommodation, you have a duty to engage in that interactive process. And that's a really critical part, if you recall, of your duty. You can't just say no. If you say yes, you can avoid the interactive process. But if it's something that you think may be unreasonable or that you cannot accommodate, if you do not enter into that interactive process whereby you explore other opportunities to accommodate, you can be on the hook for a violation of the ADA. And in that, the employee, to start it, they have to make a request, and not every request is obvious. If they say something, if they don't have to say the magic words of "I'm requesting an accommodation," so you have to be on the lookout for when they are suggesting they might need one. And then you open dialogue, and if it's not an obvious disability, then you can get doctor's input, but that's got to be very limited. So accommodations require you to provide a reasonable accommodation unless it imposes an undue hardship. And in COVID, what we see as undue hardship has really changed. If you think back to the request you might used to have gotten for remote working, and a lot of the positions that we would not allow remote working for then became routinely done by remote because of COVID and social distancing and shutting businesses down. And then that makes it a little bit more challenging for employers when you go back to work to now tell employees, no, that position can't be done remotely. There are definitely ways you can do it, but that's just one example of in the time of COVID, some challenges we're going to see. And again, as I just discussed, you have that duty to engage in the interactive process. So let's talk about some accommodation examples. One would be making facilities accessible. That's an easy one. If someone's in a wheelchair and needs to get in, or if they need handicap parking. Modified work schedules, that can be, those can be accommodations. Remote working, providing assistive devices. I had one recently involving someone who was having insomnia issues at home at night, which were leading to narcolepsy in the day. And she needed a device that is not expensive at all, but kind of helps when you're nodding off to alert you. When do you have that duty to do that? When it's just limited to work, or if they need it all the time. Reassignment, extended leave, and that's when you get into FMLA issues. We're going to talk a lot about the EEOC technical guidance, as well as their do's and don'ts. And then what you do if you have someone who objects to getting the vaccine, if you do require it. Is it a religious objection? Is it medical based? Recommendation for employees with mandatory testing versus voluntary testing. And that's really the most critical issue right now, how you should administer it. And then if we have time, some special considerations with regard to vendors and business visitors. Okay, so the timeline of this isn't the first time the EEOC has ever dealt with pandemic response and guidance. Back in 2009, they started it with just kind of the flu and general pandemic. Then in 2012, they talked a little bit more about vaccinations and the flu and what employers can do. And then all of a sudden, we fast forward. So look at that. That was 11 or 12 years in the making. And all of a sudden in 2020, we are exercising at rapid, fast pace because we have this new pandemic that's global and we need to react. So the FDA is now issuing a published emergency as of February. Then a month later, the EEOC issued its first technical guidance on the pandemic and what you can and cannot do. And that kept evolving. If you recall, we've done some of these seminars in the past, and their guidance shifted at times. Then in December, again, at this lightning speed, they revised it now to talk about the vaccination, which was on the cusp. We knew it was coming. And then we got the emergency use authorization from the FDA for the vaccine. And that happened 2 days after their technical guidance. So we were all kind of jumping through hoops to get up to speed on what to happen or what we can do. Go ahead, next slide. Okay, so what's their general rule in ADA and medical examinations? The general rule is an employer cannot conduct medical exams or ask disability-related questions unless it's job-related and consistent with business necessity. And what would be considered disability-related would be if it's likely to elicit information about a disability. So, and the medical examination constitutes a procedure or test that seeks information about the person's physical or mental health. So think about that. Different medical examinations obviously can involve use of medical equipment. They can be invasive, but they're not necessarily. So if you are starting to ask questions, for example, with regard to giving the vaccine of, have you had any severe allergic reactions in the past? Well, now you're asking medical information, and that could be considered disability-related medical examination designed to elicit that information. Next slide. So on March 17th, we mentioned earlier, the EEOC issued its technical guidance, and they said employers are allowed to ask otherwise prohibited questions in the age of COVID. And one of the next questions was, well, okay, if we can ask that, for example, do you have COVID? Have you been exposed to somebody with COVID? What's your temperature? All these questions we never would have been asking before. Well, the next question was, well, once we get a vaccine, is that going to extend to that? And yes, the answer is yes, it now has extended, and you can ask questions related to that. Next slide, please. Here's the guidance from the EEOC. Is a vaccination a medical examination? So these are the questions they have asked and given answers, and we're going to really dig deep into these today. Can an employer ask pre-screening questions if it has a program, a vaccination program? Can you ask for proof of vaccines? Where is emergency use authorization available to employees? Because right now, while it's getting more widespread, the vaccines, we know it's limited to certain populations, the elderly, the frontline workers. Now we're seeing it get expanded into teachers. So a lot of the discussions we're having might be a little premature in some realm because some of your employees can't even get the vaccine yet. But that's going to change in the next few months. And what do you do if an employee refuses it due to a disability or due to a religious belief? And is there a religious or disability objection? If there is, what do you have to do? What's your accommodation requirement? And can you fire the employee who refuses? And that's the million-dollar question. I'm going to keep you on edge for that answer. Next slide. What is the EEOC guidance and how does it intersect with the FDA Emergency Use Act status? And that's really kind of a gray area, because you've got the FDA saying we've got emergency use, but in their guidance it says you can't require it. But then you have the EEOC technical guidance referencing mandatory testing and basically suggesting that employers can require it. And so one question we've been thinking is, does the EUA status modify the EEOC's suggestion of allowable mandatory testing? And as we go through this, I'm going to explain in more detail that it really is going to depend a lot on that direct threat analysis we'll go through, and whether or not, what kind of company, what is your vulnerable population, if any. And so whether, it's really a weighing test at this point. And so we've got, again, FDA on one hand saying people may have the option to take tests, and we then have the mandatory guidelines from the EEOC. So we have in here, like, stay tuned, because we are still waiting to see what will happen. But based on what the EEOC says, I think, yes, you can require it, but in certain circumstances. So does one size fit all in this analysis? And the answer is absolutely not. So we're going to talk about two different types of employers. One is the employer who has employees who are already currently eligible to receive the vaccine. So not just some of your workforce, but the entire workforce. So in terms of looking at CCRCs and nursing homes, and as things come up with schools and teachers. And then we're going to talk about employers with employees who will be eligible in the future. And that's the most people fall into that bucket. So some of the hypotheticals we'll review in here, one would be XYZ Hospital. An XYZ Hospital wants to require all employees to be vaccinated. And the question would be, can it and should it? What about the employees that are in accounting or doing, billing, who really don't have any interaction with a vulnerable population? Versus ABC marketing firm who wants to require all employees to be vaccinated. Can they and should they? If they're really just one office, not a huge office, or even if they are a large office with multiple office locations, if they aren't working with vulnerable population, what should the employer do, and what's the difference between those entities? So let's dig into the EEOC guidance. December 16th is when they updated their guidance affirming the employer's right to require the COVID-19 vaccine. So that makes it sound like, okay, great, I can require it. Why are we even having this seminar? Well, it's kind of, you can, but just with everything that comes out. Yeah, you can fire someone that's at will for any reason or no reason at all, except, and that's kind of what we're doing here. So we've got the COVID vaccine. So if we go back to the general rule we reviewed, employers cannot require medical examinations unless they are job related and consistent with business necessity. And so under the EEOC's guidance, the vaccine for COVID is not a medical examination under the ADA, but administration of that vaccine might require pre-vaccination questions that could constitute disability-related inquiries. And that should be avoided absent a business necessity. And so these are some of those terms of art they like to put in for analysis. So let's talk about the disability-related inquiries. The pre-vaccination screening questions can be considered disability-related inquiries. And that's what I talked about earlier with, if you were asking questions like, do you have extreme allergic reactions to things? Do you have asthma? All of those could be disability-related inquiries. And if the employer requires and administers the vaccine, those pre-screening questions would likely be considered disability-related under the ADA. What is not disability-related? Well, if you offer the vaccine on a voluntary basis, so you're encouraging your employees, but you're not requiring them, then those pre-vaccine questions can be asked without triggering the ADA concerns, since answering the questions is strictly voluntary at that point. So if I, as an employer, even if I have a vaccine program that I'm offering in the office, If it's completely voluntary, you can be encouraging it, saying it's a great idea, but if it's voluntary and there's no disciplinary action at all or adverse action if the employee declines it, then you can ask those questions because answering those questions would be considered voluntary. Under GINA, if you remember the Genetic Information Act, the EEOC notes that the employer-administered vaccination pre-screening questions may violate GINA too. So for all of these issues, when we're talking about whether it violates the ADA and involving non-disability or disability-related inquiries, keep in mind in the back of your head, GINA is also potentially triggered. So what happens if the employee refuses to answer screening questions? In that situation, the remedy would be to refuse to administer the vaccine. You would not retaliate against the employee for refusing to provide the information. And so that's where it gets in. If it's strictly voluntary, then it's not triggering some of those other protections. The safest way you can go about dealing with any kind of vaccine, whether you're requiring it or not, is through third-party administration. And so if we look at this hypothetical, and you assume for purposes of this that the vaccine is widely available, it's not just in the stage 1B or 1C, it's available to anyone who wants it. So in that situation, ABC Marketing is requiring the vaccine but is not administering it. Employees have to bring proof of the vaccine to return to work. So we're saying you have to have it and you have to bring proof. Would this be a disability-related inquiry? No, because ABC Marketing is not administering the vaccine and they don't have a contract with third party who's providing it, or this does not trigger ADA issues. And so if you're just saying to your employee, go out, get it wherever you want, you just have to bring in proof that you've gotten it to return to work, none of that triggers any of those other issues. Again, unless and until they come up with a religious or disability related objection or request for accommodation, this assumes that there's none of those issues. What if Thomas, who's a nurse at XYZ hospital, is required to be vaccinated? So he's a nurse there, he's dealing with a vulnerable population or potentially vulnerable population, so there's potentially a direct threat. Their hospital employees have all been approved for emergency use of the vaccine, and the hospital is requiring everybody to be vaccinated. Is this allowed under the current EEOC guidance? The answer is yes. The EEOC said it's okay to require the vaccine, but they don't go all the way to saying you can fire for it. What they're saying is asking or requiring an employee to get the vaccine is not a disability-related inquiry and is allowed. So it's still the same as the XY or the other example with the marketing company. If you're requiring it, and you're asking for proof, it's fine. And now what happens when Thomas's supervisor asks Thomas for proof that he's been vaccinated? Is this allowed under the guidance? And the answer is yes, because requesting that proof is not a disability-related inquiry and they can ask for proof. But what happens if Thomas says he's not been vaccinated and is refusing to do so? Can the supervisor ask why? Now, before we answer that, think why could be dangerous, right? Because now, if the supervisor is saying, why, Thomas, we need this, you're dealing with people in the hospital, why aren't you getting it? What information could that elicit? Well, that question can certainly lead to disability-related inquiries. And in that case, the employer now has to show that the inquiry is job-related and consistent with a business necessity. In this situation, in a hospital, you're probably going to be able to meet that burden, right? It is a direct threat. There is a business necessity to protect the potentially vulnerable patients. And so if they know they're going to be asking that question of why and potentially getting that information that could trigger protections, we know we can probably meet the burden of showing why it's a business necessity. But what about ABC Marketing? They are not dealing with that population, so they don't have as much of an argument for direct threat other than possibly exposure to its employees. So if ABC Marketing has a policy requiring the vaccine to return to work and Rebecca refuses, does ABC have to allow her to return to work? And that's a really good question, right? Now we're saying you have to do it, and if you don't bring proof, we're not allowing you back at work. Under the EEOC's guidelines, can that happen? And that's where it gets gray. And the answer is, it really depends. It triggers two issues regarding the duty to consider an accommodation. And those two potential triggers would be disability and religion. And so when I say it depends whether they have to allow her to return to work, it depends on the reason. If she's just saying, I'm generally scared to get the vaccine, but isn't saying she has a religious objection to it, a sincerely held belief that's preventing her from doing it, or that she's got a disability that prevents her, or her doctor's telling her not to get it, then you have to go through the analysis of, now what? What are we going to do with this employee? But if it's a disability or religious issue, under the EEOC, the employer may need to accommodate the employee with a disability or with a sincerely held religious belief that prevents the employee from getting the vaccine. So then there's no really right size fits all. You're going to have to do a case-by-case analysis on each one. So if the employer refuses the mandatory vaccine because of a claimed disability, first you need to look at whether they pose a direct threat to health and safety. And that's really going to get into, what kind of work site are you? Are you one dealing with that vulnerable population where not having that vaccine could be really a direct threat to the spread of people who are most likely to have severe reactions to it? And if so, can that threat be eliminated or reduced by a reasonable accommodation? So if it really is a disability issue or a religion, and we'll get into how you can challenge those, what are the other options besides firing? Well, that's when you're going to want to enter into that interactive process that is required, right? So you look at, can we alleviate those risks through social distancing or remote working or other safety and health protections that we can install in the workplace? So, but you're going to look at those staggered shifts. Are there things we can do for that employee who has a real response, that triggers protection that allows them to still perform their job? It also requires the employer to conduct an individualized assessment of what's the duration of the risk and the nature and severity of potential harm. And again, that gets into when we're talking about ABC marketing versus XYZ hospital. One, the degree of harm, potential harm, is much greater than the other. The likelihood that the harm would occur and the imminence of it. And so if you don't think that you can make all those arguments that there really is an imminent harm if they don't get the vaccine, then it probably won't meet that criteria of direct threat to health and safety. Keep in mind, though, the employer is not required to provide an ADA accommodation if it would create an undue hardship for the employer. Undue hardship can be really tough, especially when we were talking early on about remote working. If one of the issues would be, well, we could allow them to continue doing their job if we do remote working, but we really need this employee in the office. Well, then you need to look back at, if we've allowed them to work remotely over the past year, why did we do it? Was it purely as a benefit to the employee to allow them to keep their job, but their job really does require them to be in? One example would be a bank. If you've got a bank teller, but if the branches have been closed, then the bank teller you could be keeping them busy at home if you still got them on payroll. But once you reopen the bank branch, that bank teller can no longer continue to work remotely. Versus, if you have someone who writes grants, if they can do that at home and in the workplace, it would be a tougher sell that the remote working wouldn't be reasonable. So looking at direct threat, what is the direct threat that the unvaccinated employee will expose others to virus at the work site? And if there is a direct threat, is there a reasonable accommodation that can eliminate it or reduce it? And this kind of gets into some ideological challenges, because one of the reasons people want to get the vaccine is so obviously they're safe, but also you're protecting others. If someone's refusing to get the vaccine in the office, but everybody else is vaccinated and they're not, and the other person that's not vaccinated isn't really dealing with anybody else who's not vaccinated, what's that direct threat to those people? It's almost, the direct threat would be more to her or him, because even with the vaccine, you can still be a carrier. At least that's what the science is currently saying. So the direct threat analysis is going to be difficult and required and somewhat cumbersome, but you really need to make sure you go through that before making any decisions. Reassignment, is that an option? More PPE. And that direct threat analysis is going to evolve as we get more into it. And remember, we're still at emergency use, and it's been such a fast program getting it through. We're going to keep learning more and more about the risk for people who aren't vaccinated, or the risks for people who are vaccinated. And so this will continue to evolve, and we just have to keep up to date with the most recent guidance, both from the EEOC and the science, the CDC. So let's talk a bit about the EEOC guidance and how it dealt with reasonable accommodations for religious accommodations. So under Title VII, if you'll recall, an employer must provide reasonable accommodation to an employee who refuses a vaccination due to a sincerely held religious belief, practice, or observance, unless it would pose an undue hardship. So again, we go back to that undue hardship, but what's considered a sincerely held religious belief? Sometimes that's pretty subjective. And you keep in mind that that undue hardship standard for religious accommodation means more than a minimal burden on the operation of the business, but it's a lower bar for employers than the ADA. So there is a slight difference in those. That's a little bit of a red herring. You want to just keep being mindful of the fact that if someone mentions religion as a reason for not getting a vaccine, it's triggering this whole inquiry. So let's talk about XYZ Hospital again. So XYZ Hospital is requiring employees to be vaccinated. Arnold refuses and says he's a Christian Scientist and that Christian scientists do not believe in vaccinations. Arnold, who has children, recently had a bar mitzvah for his son. Arnold's supervisor has serious doubts about the sincerity of the religious belief held. Can the supervisor ask questions? In this case, yes, right? And so if we go back to the prior slide where it talks about sincerely held religious belief as being a basis for refusing it, is this a sincerely held religious belief if he's just had a bar mitzvah for his son, but he's claiming to be a Christian Scientist? This does not mean that you can terminate or that the inquiry ends there, but you can ask more questions. According to the EEOC, if the employer has an objective basis for questioning either the religious nature or the sincerity of a particular belief, practice, or observance, it is justified in asking for additional supporting information. So in this situation, you can ask for that information, but just because there seems to be a discrepancy in what he's claiming he's a Christian Scientist versus having a bar mitzvah, that doesn't mean he may not still have that sincerely held belief. It could be that the bar mitzvah, the son follows the wife's religion and she's Jewish, but that he really is a Christian Scientist and that Christian Scientists do not allow vaccination. So in that situation, the inquiry would be related to how sincerely held the belief is. You can request some information supporting that. And then you'd also look at the doctrine. Is this a religion that really does oppose vaccination? What if there's no accommodation available? Then what are you going to do? So let's look back at Thomas at XYZ, the nurse. So after Thomas from XYZ Hospital refused to be vaccinated, he requested a disability accommodation. Ultimately, the hospital determined he was a direct threat without the vaccine, and there is no accommodation available to eliminate the threat. Now what do you do? And so that's that $1 million question I said at the beginning that I was going to make you wait for. And again, it depends. I mean, here we have the EEOC saying that you can require a vaccine. So the implication, or what you would imply from that is, okay, if I can require the vaccine, and if the employee refuses to get it, then most certainly I can fire them, right? Well, I would say don't go that far yet, because they haven't gone that far. They never put in their guidance, yes. What they've said is, if there is no reasonable accommodation possible, then they can exclude him from the workforce. But does that mean he can still be fired? Or again, then you're going to go through, are there other options? So we've gone through the reasonable accommodation. We've determined as a nurse, he can't work from home. But what the EEOC is saying is, it doesn't mean you can automatically terminate him. You need to determine if other rights apply under the EEO laws, federal, state, or local. Okay, that doesn't give us a ton of guidance, does it? Because now it's kind of like they're afraid to take that extra step. And as an employer, what do you do with that? on that, I think when they're talking about that, they're saying you need to be considering all options, including a leave of absence. So if Thomas can't do the essential functions of his job and there's no reasonable accommodation, and you've determined it's a legitimate reason for the request, so it's either religion or disability and it exists, then you might want to look at, well, can we put him on a leave of absence? And that doesn't mean it's a paid leave of absence. At that point, you're just holding his job. But you may actually then be able to terminate as well. I would consult with counsel. I don't think you'll ever have an example that's even this clear where you've got a nurse who can't do it and you're deciding what to do. You're going to probably have even grayer issues where it's just someone who doesn't work with the vulnerable population who says they can't take it, the vaccine. Then what are you going to do? And so my advice is you're going to consider every potential accommodation that you could provide that still allows for the essential functions to be performed. And then if you get to that point and you figure that none of those will work, I'd consult counsel, but at that point you may be okay in terminating. So let's talk a bit about some best practices. Keep in mind that before you require any mandatory vaccination, you want to consider the specific risks of that transmission in your workplace. And the purpose of having those two different hypos in this presentation was to illustrate that difference. And a lot of times they'll be even grayer than that. You may have a workforce that does go into people's homes or has the ability to interact with people who could be vulnerable, but not necessarily in a hospital setting. So you're going to look at that and consider what are the risks if we have someone that's not vaccinated working with those people or in that environment. Certainly those healthcare providers that are treating COVID-19 patients or that are working with nursing home or assisted living facilities, they're going to have the highest risk of transmission. So they're going to have the highest degree of that direct threat analysis. And in looking at those, and I think that's where a lot of the EEOC guidance is directed, that's going to require aggressive approach to minimize that transmission. We keep seeing those curves where it's peaking again. And so what those employers need to take drastic measures to protect that population. And that could include very well having mandatory vaccinations. But if you're not a high-risk employer, if you've got a boutique downtown, or what if you run a cleaning business? So someone's going into homes or into businesses. You still have some risks, but the risks are not as high as if they were working in a hospital setting. And in that situation, the mandatory vaccination might not be necessary if you're taking other measures such as, mask wearing and things like that. The employee refusal, it could be concerned, employees may be concerned about health risks and refuse the vaccine even if you require it once it's approved for the general public. So in those situations, what are you going to do? It's one thing if they trigger it under the disability aspect or if they trigger it under the religion, but it might just be someone who says, I don't want to take it. I don't know enough about this. This was jammed through so quickly, and they might have real concerns. And in that situation, are you going to require that or terminate the employee if they refuse? That's a really tough decision to make. And I would say if you don't have that high risk, I would not require it. I would suggest that you could strongly encourage it, but I wouldn't require it. So when I'm talking best practices right now, again, if your direct threat is so high, then requiring it may be something you need to do. But if it's not, my recommendation at this point, based on information we currently know, is to strongly encourage it. And you can even provide it on site if it's strictly voluntary. Where I would avoid getting hung up in some of those tricky situations is requiring it and requiring it on site so that those pre-disability, those disability-related inquiries could now cause you some trouble if it's not a direct threat. So what happens if you have a single employee who refuses? You're going to want to look at those options, even if it doesn't trigger, if you decide you're going to require it, even if they don't trigger the disability or religion exceptions, what are your options then? Are you going to fire the person who doesn't want to get it? Or are there other less aggressive options you could take, like requiring them to work from home or getting them additional PPE? Or are you going to refuse to allow them to return to the workplace? I mean, Again, it's going to be very fact specific. You're going to want to chat with counsel to really figure out what the best scenarios and options are. And sometimes there are different options that you might not even be considering. And so just kind of looking through, is there a different job opening? So if theirs is very customer facing, is there another position that's open for which they are qualified that wouldn't put you in such a direct threat? You know, kind of looking through all those possible scenarios. So what happens if a number of employees refuse to take the vaccine? So we've talked about it might just be one. What if it's most of your workforce, or like 3 employees who refuse? Would you still be willing to fire if they don't take it or do the same actions? And some of those options that you would have had if it was just 1 employee might not be available for more of your workforce. And can you operate your business effectively with the reduced and or remote staff if you decide you're going to require it, and if you don't do it, here's your limited options. So these are all of those things you want to consider before you decide, yes, as an organization, we are going to require all of our employees to take the vaccine. And keep in mind that if you have multiple employees complaining at one time, that could be considered protected concerted activity under the National Labor Relations Act. We often, unless you have a union, we often forget about the NLRA and what those restrictions are, except sometimes when we're working on our handbooks and what policies could trigger some protection under there. Now keep in mind, we saw, you know, more protections for the employer under the Trump administration. We're going to be seeing that pendulum shift pretty dynamically or dramatically under Biden. And so some of these concerns, so as you've got the EEOC saying, yes, you can require it, you might have the NLRA over here saying, yeah, but if you've got a few people opposing it, you can't fire them because they're opposing it, because that could be considered protected activity. And then they'd be protected from discharge or discipline. So just being, you know, a lot of times we triage things, right? Just understanding that if it's not just one person, if you have 2 or more, that could be triggering other protections that employee might have. So in review, just in terms of the employees, if you haven't gathered it by now, my advice is, based on the evidence or the information we currently know, if you're in a situation or your workforce deals with vulnerable people, or you have a high direct threat, I think going ahead and requiring the vaccine is probably appropriate. But even if you require it, if you have an employee come back with a disability or religious exception, you need to look at all possible options before you take a drastic step, such as terminating them for refusing the vaccine. If you don't have that kind of population or that high threat level, my recommendation would be to not require it, and instead to recommend it if that's what the position is you want to take, and you can strongly recommend it. Most places are already going to be free for getting it, but if it's not, making sure that you pay for it if you want to. And we'll talk in a minute about other incentives. I don't really like providing incentives to employees in these types of situations, because then what happens if you do have someone who is disabled and then doesn't have the opportunity to get that incentive? And by incentives, I'm talking like bonuses, days off, some, you know, positive things that can happen in the employee to their benefits. We want to make sure that everybody has that equal opportunity to get. So let's talk a bit about outside visitors and vendors, and what are you going to do with those? Obviously, you're not going to require that all outside visitors and vendors have been vaccinated, at least not at this point. But some things you should be considering, especially when you're weighing out how you keep your own employees safe, is limiting the number of vendors and visitors and business invitees that are allowed to enter at one time, and putting, just like you've got the social distancing and things like that in place for your employees, keeping it, making sure that you've got that attached to your visitors and vendors as well, if they need to have appointments to come in, so that you don't have a lot of people all at one time. Consider restricting the amount of time that's spent in the workplace. A lot of Zoom meetings are going on these days, right? Unfortunately, we miss that in-person contact, but for now, it's probably a good idea to continue having those virtual meetings to the extent possible, and limiting how many people are coming into the workforce, and making sure that visitors are compliant with the CDC
as well as state and local guidelines. And so now we've seen more of a mask mandate coming out, making sure they're complying with that and not allowing people in who aren't masked, and any other guidelines as they come up, which continue to evolve. The best practice you might want to consider is having visitors, again, depending on your business, sign a COVID-19 waiver of liability, acknowledgement, and assumption of risk before entering. Now, if you operate a grocery store or some store where you have traffic and you're already limiting the number of people that are coming in, I'm not suggesting that you need to have a waiver every time one of them come into your location. But if you are in more of a high risk, when you start looking at the CDC guidelines as to what's considered the exposure, it's usually within 6 feet for 15 or 20 minutes or more. So let's say you operate a salon or a spa where people are in that close contact for more than that required period, that heightens your risk of potential exposure and transmission. And so in those situations, having a waiver as well as the reporting of symptoms is not a bad idea and could be a best practice in that realm. Again, if you're in a grocery store, you're not going to have people coming back in, but you're always going to look at it on those case-by-case risks. Is it somebody who has direct contact, close contact within 6 feet for more than 15 or 20 minutes at a time? Then you might want to consider those types of waivers. And be prepared to refuse entry to visitors who refuse to comply. If someone comes in and you have a mask mandate and they refuse to wear a mask, then you don't want to let them in, because you also owe that duty to your employees to keep them safe. So some final considerations before we take some questions would be making sure you're always considering other effective solutions to reduce the spread of COVID other than mandatory vaccine. Again, in certain situations with hospitals and where you've got that direct contact that has that heightened direct threat, mandatory vaccine may be appropriate. But in other situations, recommending is going to be better, and coming up with those other options if someone's got issues in terms of not coming to work or they can't come to work without the vaccine. Strongly encouraging the voluntary vaccinations is perfectly fine. And if you offer them on site, that's perfectly fine. You just don't want to require them and be the provider or the transmitter of the vaccine. That's when it gets a little dicier. And always being compliant with the relevant CDC and state local guidelines. I mean, again, these keep changing. Before, mask wearing wasn't sure, and then it was, yes, you needed to wear a mask. Now they're talking about very specific masks that are more appropriate or more helpful in preventing the spread. Social distance we've known of, limiting the numbers of employees in the workplace and the duration of their stay, and requiring employees to work from home whenever possible and practical. Considering even when there's travel in the place, we're still thinking about all of those things. If people are traveling to other jurisdictions where it's higher, or if there's a mandatory quarantine requirement, looking at all those options as well. But that gets us through the mask and the vaccine. Are there any questions? I know, Rachel, you've been monitoring.
We did have some questions come in. The first one is, what happens if an employee or employees refuse to come to work because we are not requiring vaccination?
So that's a pretty easy question to answer. If they don't want to come in and it's because you're not requiring it, again, unless you're in that hospital setting, which it's going to be required, that's not a good excuse. Now, you're going to look at the same inquiry for that as you would if someone was refusing the vaccine. Why? Why aren't you coming to work? What is your opposition? If it really is a disability related issue, in this situation, I don't think you're going to have a religious objection to that. But if it's a disability related thing, then you're going to have to require documentation from the doctor as to why they can't come in if not everybody's vaccinated. What's the direct threat to that employee? I mean, in theory, the vaccination is supposed to protect the one that's vaccinated. And then we get to herd immunity. In this situation, if the person's complaining that Joe in his neighboring office isn't getting vaccinated, but he is, what's the direct threat to the person who's vaccinated at that point, especially if you're still requiring mask wearing and other things. But if you do get a note from the doctor that says that they need this accommodation of not coming in unless and until every single person is vaccinated, which I'd be very surprised if you would get that. then you look at what are the other options. If you get that documentation, you treat it like any accommodation request and determine whether they can fulfill the essential functions of the job with an accommodation, which could be working from home. If they don't provide that, I think you require them to come to work if that's what you're doing with the rest of your workforce at that point.
So I think you touched on this one briefly, but it's definitely a good one to go over again. If my entire staff gets vaccinated, can we stop all of the other safety measures, such as wearing masks, social distancing, and physical barriers?
No, not now. What they're saying is even with the vaccine, they still require mask wearing and the social distancing for best practices. And that's a good question because, and I think part of it is because even with the vaccine, you can still be a transmitter or a carrier of it. So it sounds like until we get to that herd immunity, we're still going to be required to follow all of the social distancing guidelines, even with the vaccine. If your entire workforce is vaccinated and you don't have visitors, I still think until we hear differently from the CDC, you have to follow those recommendations. So just be on the lookout for all the different guidance. Again, it continues to evolve and follow those best practices as they provide.
Great, I think that we have time for one more. Assuming the vaccines become publicly available in the next few months, is my company okay in making the executive decision now to mandate vaccination?
So to that, I would say no. I'd say, even if you're making that analysis now, a lot could change between now and June. So right now it's not publicly available. And everyone's best question now is when will it be? And if it really does take till May, June, July until that happens, a lot could change between the EEOC guidance, the emergency use, the CDC, especially with the change in the administration. We're going to see more employee protections, but weighing those out with protection of everyone across the board because of the pandemic. And so, a lot of the guidance that we're relying on was administered under the prior administration. And so it's possible that some of what we've been told is going to be rescinded or get even stronger. So we just want to keep an eye out. And while it's great to be proactive and making, analyzing the options now as you get back into working on site, it's important to realize that this information continues to change. And so whatever you decide now could very well change in 2 or 3 months.
Great. So if we were unable to get to your questions, we will be sure to follow up with you after the presentation. Thank you, Jen, for the informative presentation, and thank you everyone for attending today's webinar, COVID-19 Vaccine Employer Considerations. On behalf of Whiteford, Taylor, and Preston, thank you for joining us today and stay well.